Good day. Before you, we have Amy Newland, Miranda Bartholomew, and Sarah Crane as your analysts. Now, the purpose of this presentation is to reveal the gaps, causes, and evidence that we found after reviewing the complications at your hospital. Now, by the end of this presentation, you will receive some recommendations to cure the current issues at hand. Based on our work together, we've discovered that your hospital is definitely experiencing preventable complication, including patient deaths. So we recognize that there's urgency in making sure that patient care and safety are reinstated right away and properly. We also understand that you want to avoid heightening legal expenses any further. And most importantly, the reputation of Pyfer Hospital is really important, and we understand that you want to protect it. Now, those that are going to benefit from the solution of the performance gap will include your external and internal stakeholders. For example, your external stakeholders would be your patients, the families of patients, or any future patients that you might have that might transfer from within your state or outside of your state seeking quality treatment. Your internal stakeholders are going to include employees or staff, any of your doctors, nurses, therapists. Now, on the upcoming slides, Amy and Sarah will continue the presentation by sharing an overview of the analysis that's been completed.
Gap 1. Pyfer General Hospital saw a substantial increase in complications and fatalities last year, particularly in the hospital's lower performing units. The increase in fatalities and complications in the hospital has alarmed the administrators, and they decided to perform a gap analysis and investigate why the lower performing units are not performing well when it comes to complications and fatalities compared to the higher performing units. Data. As the chart indicates, last year the lower performing units recorded 80 incidents compared to 7 complications in the higher performing units. The 5 deaths reported in the lower units were the only fatalities recorded for the hospital last year, while 0 deaths were recorded in the higher performing areas. The desired state the hospital administrators want to model aligns with the higher performing units numbers of 7 complications and no deaths. Cause. We believe that the main cause of the gap is the unit director's failure to implement the medical device in the lower performing units. Based on the information gathered, unit directors in the higher performing units have adopted a top-down approach, adopting and using the new mobile devices to aid in medical decisions, helping to reduce complications. In the lower performing units, we do not see the same approach from the unit directors. Based on the statistics and responses, the lower performing units do not see the true value of the mobile device. The category of this cause is motivation and expectation. The unit directors lack of belief in the value of the device, which transfers to the actions and performance of their nursing team. This belief has contributed to an increase in complications and fatalities that are not shown from the higher performing units. Gap 2. Pyfer General Hospital has experienced a large gap in turnover between the higher and lower performing units, with the lower performing units having significantly higher staff and management turnover. Pyfer General Hospital has a well-known reputation for bringing in top-ranked nurses and doctors, and it is unusual to see such a large turnover volume in the lower performing units. Data. Based on the data collected from the case study, staff turnover was 31% and management turnover rates were 7%. In higher performing units, the numbers were far more reasonable, with a staff turnover rate of 8% and 1% of management. This is an alarming figure for the lower performing units that needs to be addressed at Pyfer General Hospital. In other words, 69% of junior nurses stayed with Pyfer General and 93% of management stayed in the lower performing units. The desired retention rate would reflect similar numbers from the higher units, where they would retain at least 82% or less than 20% turnover of junior nurses and 99% or less than 5% turnover of management. Cause. At Pyfer General Hospital, overall patient care comes first. We believe that one cause for the gap in staff retention is due to the inconsistent working methods between the upper and lower performing units. The category of this cause is motivation and expectations. One of the nurse supervisors and senior nurses from the high-performing units indicated that although the initial transition from paper to the mobile device interfered with their day, using the mobile device was deemed to be a better process in comparison to using the paper method. This is not the case with the lower performing units that still had to go back and forth between paper and mobile units and may lead to inconsistent working methods causing higher turnover. Excessive turnover of staff and management prevents Pyfer General from fully exercising their mission of putting the care of patients first. Gap 3. Pyfer General Hospital's mission is putting patients' needs first, and patient satisfaction with care can be measured by the Patient Care Report survey responses. Here, patients are able to rank if they are satisfied patients with the care that they receive from the nurse and physicians. Gap 3 addresses the issue that overall quality of care in the past year from doctors and nurses is significantly lower in the lower performing units than the higher units. Data. Based on the data, the lower performing units are not providing exceptional patient care compared to the higher performing unit satisfaction rates. Patients ranked doctors 4 out of 5 for quality care and 3.4 out of 5 for nurses' care. In other words, that's 80% of the time patients were satisfied with their doctor's care, and only 68% of patients were satisfied with their care from nurses. This figure is very high compared to the ideal state based off the high-performing units that rank 4.6 and 4.7 out of 5 in patient care or satisfaction of around 90%. Cause. Patient care is critical for Pyfer General Hospital as they continue the mission to be one of the top-ranked medical facilities in the country. The attentiveness to patients' pain, discomforts, relationships, etc., from nurses is critical to improving their well-being and enhancing the overall recovery experience. The category for this cause is environmental support, and resources at Pyfer General need to examine in detail what type of environment and culture is successful in the higher units and transfer this to the lower performing units to improve overall patients' satisfaction. Gap 4. Administering proper medication is what Pyfer General Hospital aspires to and is measured by the internal nursing report response to the survey questions if patients receive the correct dosage of the proper medication on time. Incorrect medication being delivered at Pyfer General Hospital comes from lower performing units of the hospital with lower success rates in distributing the correct medication. Data. The internal nursing report reveals low-performing units have a 9% increase in administering incorrect medications, 11% increase in administering incorrect doses, and a 12% increase in not completing medications on time, and a 24% increase in not reporting errors within 5 minutes. Based on the survey results in lower-performing units, 90% of the time medication was delivered correctly to patients, and 88% of patients were given the proper amount. The lower performing unit staff administered the correct medication on time 85% of time. In other words, the lower performing units 10% of the time the team gave out the wrong prescription to patients. 12% of the time medicine was not in the correct dosage amount, and 15% of the time the staff was not able to administer medication on time to the patients. Cause. At Pyfer General Hospital, it is critical that the hospital address any issues with regards to errors in dispensing medication, as it can lead to complications, poor patient satisfaction rates, and in some cases death. Hospital administrators stressed that the hospital review the lower performing units in regards to the improper distribution of medication. The cause for this difference is the poor team environment in low performing units. The study shows that the low-performing units have not fully implemented and supported the new computer system, whereas high-performance units have, increasing their units' integration with other units and the hospital pharmacy. The cause for this category: environmental supports, resources, tools, data, information, and feedback.
Our team's explanation for the increase based on the case study is that the unit directors are not setting proper expectations for the nurses and staff in the lower performing units. Based on the case study, there are examples of nurses from higher performing units working together through conflicts and being open with each other that contributes to their overall success. It is unclear if that same expectation is being applied to the lower performing units. The unit directors from the lower performing units would benefit significantly from leadership development. Top-down leadership is needed for the overall unit to work and perform better as a whole. It begins with the unit directors giving clear instructions and clear expectations of what is to be done and how. For the next intervention for TQM, we recommend an intervention that will institute a process which encourages quality management for the use of medical devices. The high-performing units have been able to adapt and adjust to the new mobile system and move away from the paper model. Nurses from the case study reported advantages in using the devices to increase the quality of patients' overall care. Our first solutions rationale is motives. For staff to motivate, they need to know what is expected. Unit directors will be most impacted by this solution. Our second solutions rationale is instrument and will impact unit directors, junior nurses, and senior nurses. Best practices are what keep patients healthy and safe, and the mobile system needs to be used by all units, not just some, to ensure success. Lastly, Solutions 3 rationale is data. Establish the procedure and verify use. Junior nurses and senior nurses will be impacted. The leading indicator is the receipt of a signed memorandum agreeing to the exclusive use of the mobile device from 100% of all staff and management. And the lagging indicator is after 90 days, the internal nursing report indicates 3 medical errors or less in 3 months and 0 fatalities. After 9 months, 7 or less medical errors and 0 fatalities. Gap 2, the culture at the hospital needs to be addressed to improve staff turnover. A work-life balance is needed to keep the staff engaged and wanting to come back to work day after day. A stable and supportive work environment is needed to motivate and encourage staff. The lower performing units do not seem to work as well together and have not adapted to the new technology like the higher performing units. Our solutions rationale is motives. Staff needs to feel supported to succeed. Junior nurses, senior nurses, unit directors will all be impacted. The leading indicator is a 7% increase for junior nurses retained and a 3% management retained after 6 months of implementation. The lagging indicator is a 14% increase in the retention of junior nurses and a 6% increase in retention of management after 12 months of implementation. In regards to Gap 3, patient satisfaction surveys indicate the quality of care provided by the nurses in the low-performing units is substandard due to the lack of environmental support and resources available. As an intervention, we are recommending team strategies from the empowerment and organizational design and development category. Our study reveals that high-performing units are more apt to resolve conflict quickly with one another, leading to improved relationships, increased understanding in the workplace, and immediate solutions. As a result, they have experienced significantly lower turnover rates, resulting in much higher patient satisfaction levels. We also recommend realigning and restructuring the way in which the unit operates and functions. This intervention will consist of a layering of steps to ensure the critical parts which are negatively impacting care are corrected properly and more aligned to the actions of the high-performing units. We believe eliminating the use of the paper method is the most important step in the realignment process. Eliminating the paper method completely will remove any temptation from staff or management to revert to the old method, and it simply will not be an existing option. Our first solutions rationale is knowledge, and the second is instrument. Junior nurses and senior nurses will be impacted. Nurses like to learn from other nurses, and no one can demonstrate the effectiveness of the system more than units that already successfully use it. The leading indicator is 100% in-service attendance, and the lagging indicator is patient satisfaction surveys showing a 15% increase in quality care from nurses after 6 months. For Gap 4, since low-performing units have increased rates of incorrect medication and doses and delayed distribution and reporting, we recommend utilizing a learning intervention, which will include aspects of quality improvement and performance support interventions. It is true that the system not being fully implemented has caused a breakdown in process and duplication of work, but we first must look at why the system is not implemented. Since junior nurses in higher performing areas are not having the same medication errors as those in low performing units, and all units receiving the same system training, the cause is not the system knowledge. The cause is the unit's environment. Our first solutions rationale is motives, and the second is data. Staff needs to be educated, motivated, healthy, and have support available at the time of need to increase patient care time and safety. Training will improve the unit, making it more of a team within and then also with other units. The leading indicator is the system use increase by low-performing units to the same level as high-performing units. Lagging indicators are the end of paper methods after 1 month and correct medication and dosage administration 99% of the time after 3 months.
Change is inevitable and also hard for many to adjust to. So, a great way to support your staff through change is to include them. Initiate a stop, start, continue activity, which is used in many businesses to identify social themes and trends that may be happening in the workplace. So, for example, ask your team, what should we stop doing that will negatively impact care? What should we start doing to improve patient care? And what should we continue to do that is enhancing their care? Not only that, we also recommend gaining commitment from staff every step of the way by recording their effort. For example, ensuring there is a sign-in sheet for all in-services and trainings, or by signing a memorandum to use new equipment. We understand that change is never easy, but with a plan, your team will succeed. We thank you for your time and we hope you take our interventions into consideration.